Hello everyone, welcome back to our channel. In this video, we will talk about the fracture of the clavicle bone. The fracture of the clavicle bone is the most common fracture that occurs in the body overall. It is the most common fracture that occurs in children, and it is also the most common fracture that occurs during birth. Now, the fracture of the bone occurs when the person falls on the shoulder. So the entire weight of the body is transferred to the shoulder, and as a result, the bone breaks. It can also occur when the person falls on their outstretched hand. Now, let's talk about the patho-anatomy of the fracture of the bone. The most common site for the fracture is the middle third, that is, this part. The middle third is the most common because it is the thinnest portion of the bone. The second most common is the lateral third, and the medial third is the least common site. Now, we'll talk about how the two segments of the broken bone get displaced in the opposite direction. So, the lateral portion or the outer segment, which is this part, is pulled medially by the pectoralis major muscle, and it is also displaced downwards by the weight of the arm and the gravity. And the medial or the inner segment, which is this part, is pulled upwards by the pull of the sternocleidomastoid muscle attached to it. The diagnosis of the clavicle fracture is mostly done on the basis of the clinical features. Firstly, there would be a history of trauma present where the patient would say that they fell on their shoulder or they fell on their outstretched hand. There can be pain, swelling, crepitus at the site of the fracture. There can also be bruising present. There can be neurovascular deficit in the distal portion of the limb, and there can also be tenting of the skin as shown in this figure. The diagnosis can also be confirmed by an X-ray. In this X-ray, we can see that the clavicle bone has fractured and the segments have also been displaced. Now, let's talk about the treatment of the fracture of the clavicle bone. First of all, immobilization has to be done and pain relief is provided by NSAIDs. Most commonly, the two segments unite readily and hence the reduction is not necessary in most of the cases. If there is minimum displacement or no displacement, then a triangular sling is used. If there is some displacement present, then a figure of 8 bandage is used. This is a figure of 8 bandage, and it serves the purpose of immobilization and pain relief. If there is severe displacement or if the fracture is associated with neurovascular deficit, then open reduction and internal fixation has to be done. Now lastly, let's talk about the complications of the fracture of the clavicle bone. There can be either early or late complications. In early complication, there can be an injury to the subclavian vessels or the brachial plexus, as these two structures are very close to the clavicle bone. So if the bone breaks, then it can lead to an injury to these structures. This further can lead to neurovascular deficit in the distal part of the limb. And in late complications, first of all, there can be shoulder stiffness. It mostly occurs in elderly patients and it can be prevented by early mobilization, where the mobilization is done as soon as the patient is pain-free. The next is malunion. Malunion is when the segments do not unite in proper position. It is said to have been malunited. And the last is non-union. It is not very common. It is a very rare condition. And both malunion and non-union, if occur, mostly they do not leave a functional deficit. So a treatment is not required. But rarely for a non-union of the fracture, open reduction and internal fixation is done with bone grafting. So this is all about the fracture of clavicle bone. If you have any doubts, leave it below in the comment section. Thank you for watching.